Hello, and thank you for joining us today on Care Connections, a podcast series where we have real talk on rare conditions. Sanofi Genzyme has been committed to supporting the rare disease community for over 35 years. Today, we're going to explore living well with a rare disease. There's no question that living with a rare disease poses many challenges that are unique to each person. While everyday life can be hard for someone living with a rare disease, developing strategies to help live with their condition can help. So joining us today for our episode to talk about well-being and the emotional and psychological impact of being diagnosed with a rare medical condition is Dr. Kendra Bjoraker. Dr. Kendra Bjoraker is a pediatric neuropsychologist and is an expert in well-being and lysosomal storage disorders. We are so excited to have her on today's episode. Let's dive right in. Welcome, Dr. Buraker. Can you introduce yourself to our listeners?
Well, welcome me. Thank you very much. I am a pediatric neuropsychologist, and I have expertise in rare genetic diseases as well as neurodegenerative diseases. For those that don't know what a neuropsychologist is, we have expertise in how behavior and skills are related to brain functions and systems. And I've been a faculty member at the University of Minnesota and again at Children's Hospital, Colorado. And I now live in Minneapolis, Minnesota, where it's a little chilly today. And I have my own private practice.
Excellent. It's a pleasure to have you here with us. So it's sometimes contradictory to associate the terms living well and chronic condition. In your own words, can you give us your definition of well-being?
Sure. It is contradictory when you think of, wow, I have a chronic condition and living well. Most people think that those two terms can never come together. It really means it's not just the absence of disease, but the presence of physical, mental, and social well-being. But really, when you think of everyone on the face of this earth, they all want to live their best life they possibly can, regardless of what they're going through, whether it's a diagnosis or something else. Each person is different, and every life situation is changing. So my day today won't be the same as tomorrow. And in that change, you have to adapt a little bit to the necessary changes in order to be fulfilled in life. You have to, certainly there's lots of challenges, but to just begin the level of acceptance, even if it's a small bit of acceptance. And what most psychologists call that is psychological flexibility. It's the idea that we need to present with what's happening right now, not judge ourselves, just move forward through what we are in right now rather than getting stuck.
That makes a lot of sense. So what I hear is that while there's a level of acceptance that needs to be had, it is definitely possible to have a sense of well-being, even though diagnosed with the lysosomal storage disorder.
Yes.
So in your practice, how do you find that patients typically react to a diagnosis? Are they scared or shocked? Can you sort of talk about that journey a little bit?
You just hit on everything. They go through absolutely every emotion possible that humans can go through. Just like we were talking about, how can you live well with a chronic condition? This is also a little bit contradictory in that some people who receive a diagnosis are really relieved to get an answer because they've been waiting. They knew that something wasn't right. And sometimes they wait 10 or 15 years to get diagnosed. And that's a long time not knowing. So after they get it, they're relieved, but then they go through all this. Are you kidding me? I'm so confused. Why didn't they find this? And then I'm scared. But over 2 decades of doing research, people still want the same things. And it's so true for what we're living and going through right now is they want certainty. They want to know what is going to happen to me a year from now, 3 years from now, 5 years from now. They want their life to get back to whatever they termed as normal. So whatever normal they had before, they want to get back. And really, that's how we are as humans. We get a diagnosis and we don't know what to do with it. And there's no place in our minds that say, I have a lysosomal storage disease. So we begin to build that shelf on our mind. And the more we know about it, we put everything on those shelves, and then our life begins to take on more of a normalcy. The third thing is patients really want to be validated by their doctors. They want to build up a good team. They want to be heard. And then once they do all of those things, sometimes the shock, confusion, denial, the fear of the unknown get better.
That makes a lot of sense.
Going through this journey, when we talk about a lysosomal storage disease, most of the time they think of it as something physical. But I want people to know that it's just not the physical part. So it's a fancy word that psychologists call biocycle social. So you get the biological part of it. You get some of that physical part that you hear a lot about when you go to the doctors. But you also need to know that there's psychological and there's psychosocial elements to having a diagnosis. And so just as an example of emotional, it might be fear, anger, shame, guilt. And then psychological is, you could become depressed, anxious, or develop phobias. A lot of times I've seen over my career, some people develop what's called obsessive compulsiveness, where they think about it and then they manage their world by doing ritualistic things because they have control of their world by doing those ritualistic things. And that calms them down. But we don't want to discount the physical, which is pain, fatigue, extreme fatigue, and then trouble sleeping.
And do you find that differs between health conditions, whether it's chronic or acute?
Oh, yes. An acute illness can be serious. It can be diagnosed, treated, and then it somewhat resolves. You can think of it maybe, coming on. You might have it for a while, but there is a treatment, and then it resolves over time, where a chronic illness is different. So receiving the diagnosis is only the beginning. Chronic diseases are usually what we think of long-term health conditions that threaten your well-being. It's episodic, continuous, or it could be progressive, and it goes on for many, many years. So not minimizing what it is. Your experience can help you to honestly assess your condition, your options, and your choices. But yes, there's a difference between acute and chronic. Chronic is long-term.
Is there anything specific regarding the emotional journey that is very specific to the rare disease journey?
Well, in my experience and from what research says is that they show emotional effects of a genetic condition, guilt, if it's passed on to other family members. They have more anger and uncertainty and depression. So it's grief about that. And, individuals with chronic condition have known that something's not right. So that's a little bit different too. It takes a longer time to get diagnosed. And then sometimes one family member is diagnosed. And then what I've noticed is there's one person who gets diagnosed and they become the champion. They become the one who holds the torch to get everybody else diagnosed. If the other family members don't get tested or diagnosed, then the person who gets the first diagnosis becomes very frustrated. They begin to panic. They become disappointed when there's denial. Here's what denial is. It's the strongest defense mechanism. And if you're in denial, you don't have to do anything.
Right.
Because once you accept that, whoa, I might have some of these symptoms, I should go get checked. But if I get checked, then I might have to do something proactively. And that is really the difference between, having a chronic genetic condition and another condition.
That makes a ton of sense. And we hear that a lot in speaking to a lot of different patients as well. So, you talk a lot about this acceptance period, but also a grieving process. So what does that actually mean? And what does that look like?
When you get a diagnosis or your loved one gets a diagnosis, it hits you in the gut. You don't know what to do with it. And many, many people, and I wish we'd talk about this more, do not understand the grieving process. They can say, oh, I'm angry, or I don't know why I'm acting this way, or why am I irritable, or why don't I want to be around people? Why do I sleep too long? And when you tell them you're going through a grieving process over the loss of their health or the ending of a previous known life, then it kind of makes sense. I think that as professionals, we need to explain this better because a lot of people get stuck in one part of a grieving process. There's many types of grieving processes. But if you get stuck in being angry all the time or being irritable or frustrated or really bitter by it or hostile, then that hostility and anger goes into depression and hopelessness. So healthy grieving is normal. It is what everyone goes through. And it's not, oh, I'm going to go through it once and I'm over. So let me give you an example. Here in Minnesota, let's say that you do not tolerate the cold and the heat, and we're coming up on winter. You could go through the grieving process all over again because it means you can't get out. It means that you can't get your groceries. It means that you're going to have more pain because of the frigid cold. And so that grieving process starts all over again. I see it during seasons. I see it during holidays. It's just there, and we have to say, wow, maybe I'm going through a little bit of grieving, but it's also a process that you have to go through for healing. It's that inner voice can be very critical, judgmental, and you can't listen to that little voice, but you have to listen to this is a process. It's a series of little tasks that I have to complete, not in sequence, but I have to go through them to be healthier.
That's really interesting. And so I can imagine a lot of times when you're working with different patients, you're helping them sort of, one, understand that what they're going through is a grieving process, but also help develop some strategies in terms of how to work through the grieving process. So what strategies and coping mechanisms do you recommend for people experiencing these challenges or going through a grieving process?
That's a good question, but there's not one answer for everyone because we're all different. We all come into this world with a different perception. The day that you're born, I'm born, we filter everything from that moment on to what I call is your glasses of perception. So based on your temperament, based on how your parents coped, based on your, the way of life, even where you live. But we all really have the same basics to master this. For one, you have to understand your disease or your condition inside and out. You have to become an expert at it. And then you have to, if you get stuck in somewhere that is not productive, like depression, anxiety, a lot of anger, irritability, or mood swings, there are some short-term therapy that would help. There's also practicing relaxation techniques. And I've told my patients before, when the Navy SEAL go into battle, every time they go into battle, they do what's called the 4x4x4. So they take 4 deep breaths, they hold it for 4 minutes, and then they exhale for 4 minutes, and they do that over and over again. So anything that works for you, making sleep a top priority, doing things that you absolutely love. Other people don't have to love those things, but as long as you do. This is going to sound ridiculous because I don't like the word exercise. I think it's kind of off-putting. But any type of movement that you do is really important. Just get up and move. And then finding hope, talking to people about your diagnosis and your fears, and then just connect any way you can. And then take little small goals. I'm not talking about these major, major, major goals. I would suggest to limit your online world to more positive information. And then many times people just want, you just want people just to listen. Instead of always explaining what you have, you want them to listen. But take the small steps, seek help and support, regain control, reduce uncertainty, develop self-management. Just take an active role, but find meaning. I can't stress this enough. To find purpose in the diagnosis, but don't look at yourself as only the diagnosis. You're so much more than that.
That is so true. And oftentimes when we speak to patients, they like to say, I have this condition, but I am not this condition, which I think is an important distinction. When you were talking, you mentioned people finding support and talking about their diagnosis and feelings with others and really building those connections with other people. I can imagine having those types of discussions with people might be difficult, especially if the diagnosis is new. Do you find this in your practice?
I find it all the time. What happens is they get a diagnosis and they want to share it with everyone. And then pretty soon, there's a turning point where they say, I'm not going to share with anybody what I have, because it's so difficult telling others that we have a chronic condition because you don't want to be judged.
Do you find that the difficulty of having those conversations also changes based on who they're having the conversations with?
Oh, yes. It's all about context. So, for example, friends usually know that somebody that they have a buddy with or a friend with are less judgmental. So friends are typically less judgmental. A lot of people with a chronic condition never tell their colleagues that they have it because they don't want to be judged and they don't want it to interfere. They don't want anybody to ever say, oh, you're just making an excuse when some long absence arises. In fact, a lot of times they take a lunch break and, they'll go to their care team or something because they don't want anybody to know. And so they feel very threatened or fearful of telling their colleagues or their boss that they have a chronic condition. In the long run, when you look at the data, in reality, most colleagues are very understanding. And what I have found is that most people with a chronic condition actually work harder because they feel some way that they have to make up for it. Family members, can be challenging because family relations shift over time as roles and responsibilities change. So relatives can be uncomfortable. Like, let's say you go to a picnic. Oh, are we going to mention it? Should we mention it? Are they going to mention it? What should we say? Because we feel so badly that they quit going. They quit going to these activities. So it's different depending on context and the crowd that you run with, but you have to identify your own needs, recognize that life is more than the chronic condition, and just tell people about your chronic condition, and you be your own judge.
No, that's really, really good advice. What tips or strategies do you typically recommend to either start that conversation or have more productive conversations? As you just mentioned, that example with the picnic and the family, like what advice would you give to someone to sort of navigate those conversations?
Well, to navigate it, I start very early. Have a script in mind to explain your condition. You have to have a script in mind that says, I have this, it is caused by this, and it causes these types of symptoms. And if you have a script every time, then you become empowered because you can just confidently say that to a healthcare provider, your family, mental health professional, or someone in your social network. So to communicate, this is good for everyone. You have to communicate with a purpose. And you have to communicate knowing, okay, am I going to solve a problem? Am I going to make a point? Am I going to just share an experience or an insight, or do I have some wisdom? But it should be uncomplicated, very specific, and then make sure that they get it, that they kind of understand. And this is a big one that they understand.
I think that's helpful advice in any context. I think everyone could use a little course on effective communication.
Oh, yes, that is true.
So you also mentioned sort of having conversations with your healthcare team and then also mental health professionals. And we know that many patients work with psychologists, and this can be a sort of unknown process for someone newly diagnosed who's never gone to see a psychologist. What would you recommend for patients looking for a psychologist?
Well, first, what I want to say is I want all the listeners to understand that part of your team is a psychologist. So when you think of building up your team, think about, you have your doctor and you have your specialist. You could have a neurologist, a nephrologist, you could have a cardiologist, you could have an audiologist. When you think of building up a care team, a psychologist really should be on there. And that just comes with building that shelf in your mind, like I was talking about. That's one of those books that should go up there. There's a lot of prejudice around seeing a psychologist, and they're so helpful, but you have to know what you want them to work through. So if you want them to work through anxiety, depression, or just problem solving, first, you have to know what you want to work through. Then you have to know what their training is in. So you don't want to go to somebody who specializes in phobias if you're there for depression. And then go to somebody and tell them about your particular issues. Make sure that they are understanding and that you look for somebody who's in a professional organization like American Psychological Association. And then when you find somebody, this is really true for everyone, if possible, request an informational phone call or just a meet and greet to see how you kind of jive with the person. You can tell, like, oh man, are you kidding me? Or you can say, I like this person. But you have to feel confident in their skills, and you also have to trust them.
Yeah, that is really critical. And I like the point about that a psychologist should be part of the healthcare team. It goes back to your original point about how it's both a physical condition, but also so there's a psychosocial component to it as well. So that's really good advice. You talked about building trust once you've had your first informational interview with your psychologist, and there's an underlying sense of trust there. What would you recommend to ensure a good patient psychologist relationship thereafter?
You really have to see if the therapist or psychologist recognizes you as a person and not the condition. And so, sharing information, if they can share it with clarity, if they have positive regard, so they listen to you, you listen to them, they're kind, and you can understand what they're saying. It's very important. Finding the right therapist isn't easy, but chances are you will find it very, very helpful. And so it's very bi-directional. You have to find somebody that can explain some of the psychological concepts, and then the patient has to let the professional know how best would they like to receive the information. And a lot of compassion, support, and nurturing, and understanding, and validating to give you some good, sound advice. Yeah. Someone who's committed to you, committed to understanding what your rare genetic disease is, putting themselves into your shoes is very, very helpful and good qualities to look for.
So we've discussed a lot, and we've talked about the diagnosis journey and emotions it can cause, coping strategies, tips for good communication, and then how to seek help from a psychologist. But I think a lot of our listeners may ask, how do I start? So do you have any tips for our listeners on how to get started on a path to well-being?
To get started on your path, it is a culmination of everything that we've just discussed. And so you have to go through some sort of process. And when you finally realize, okay, I have this chronic condition, you learn everything that you can about that condition. You become the expert. You self advocate for yourself because knowledge is power. And that is a term that we call self efficacy. It is your confidence. See, self esteem is a term that means how am I feeling about it? Self efficacy is actually the steps you take. Am I confident in the steps that I need to self care? It's just like riding a bike. You're not confident once you get on the bike, but then after you get off the bike, you're confident. And you train yourself and you train your mind and you have compassion for yourself. And you get comfortable with some of the uncertainty. And I have a little story I want to tell you.
Yeah.
And I got permission from my husband to tell this story. So a few years ago, my husband and his buddies met in Wyoming, and they decided to climb one of the highest peaks called Gannett Peak. And it's very steep. And before they left, they were all like, sitting around. They go, oh, if we could just make it to base camp, we're going to be really, really happy. So they trekked in, I think it was like 15 miles in, and then they made it to base camp. They made it to the summit, but they were about 4 hours from reaching the summit, and they turned back because the sun was going down. And when he got home, he goes, oh, I didn't make it to the summit. And that's what I'm talking about, how to frame things so you can frame it in a different way. And I said, well, wait a minute. When you left, you just wanted to make it to base camp. You made it to base camp and you almost made it to the summit. And he goes, yeah, that's right. I did. I almost made it to the summit. I said, so you surpassed your goals? And he goes, yeah, I surpassed my goals. Now, I don't have to tell you what it's like to live with a psychologist. but that's what I'm talking about, is that self-efficacy. You empower yourself to know everything you can about whatever condition you have. And then you persevere and you go forward with it. And you're going to have setbacks, but then you go further forward with it.
No, I love that story. And I think that is so true. A lot of the way that we, you talked at the beginning about we have these perception glasses on. And if we reframe a situation, there could always be sort of a positive way that we could reframe it and look at it, which I think is sort of that story you told of your husband.
Yeah, it is about reframing. It's hard to do, but, sometimes you just have to turn it around a little bit and say, I'm not doing well today, but really I did outstanding yesterday. Pat yourself on the back for that and give yourself some positive talk. It's really difficult when you're tired and you're in a lot of pain, but even just one little high five, give yourself, makes a huge difference.
That's so true. So what support and resources do you recommend for patients?
There's several local and national rare disease organizations. Care Connect is very good. They have many knowledgeable people there. If you're in search for a psychologist or a therapist, like we talked about, here's a little trick that I sometimes let my patients know is if you take your insurance card, no matter what insurance you have, and you turn it over, there's a number of a mental health on the back. And you can call that. And then also I tell my patients to go to the website, American Psychological Association. And it actually has, by listing of state, some of the therapists. Or you can call your provider and just say, I need someone to see me. So you, again, know who you want to see.
You have given so much amazing advice throughout this episode, and we're so lucky to have spoken with you today. Do you have any final last words for our listeners?
I just wish I could just virtually hug them. I've worked with patients for over 2 decades with lysosomal storage diseases. And through those many, many years, I've met so many people who have become my heroes because they teach me really what perseverance is, and they teach me what resilience means. They teach me to live in the context of your diagnosis and the diagnosis they didn't ask for. And for me, they're the hope holders.
Well, you have devoted so much of your life to helping people with rare genetic diseases, not to mention their children, families, and caregivers. So you're such an inspiration as well. And we thank you so, so much for your time today.
Thank you.
Thank you again for listening to this episode of Care Connections. Make sure you check out our next episode, Caring for a Person Living with a Rare Disease, where Dr. Buraker joins us again to talk about caregiver well-being. So remember, whether your needs are large or small, your Care Connect PSS team is here to provide the support you need. To learn more about the range of support offerings and to contact your Care Connect PSS team, call 800-745-4447, option 3, or visit www.careconnectpss.com. Be sure to tune in to our next episode.